welcome back. This is Dr. Hub. So today we'll look at the cutoff points. This is in case of the diagnostic test. So to begin with, we will see the possible cutoff value. So by drawing the graph, we have the number of people in the y-axis, and on the x-axis there is the test results. So we have a graph, it peaks, then there is another graph. So the graph on the left, this is nothing but the TN, that is a true negative, that is here the disease is absent. So the disease is absent, and this will be the TP, that is a true positive, and here nothing but the disease will be present. So if you look here, the intersection, this is on the left, this is going to be FN, that is false negative, and on the right it's going to be FP, that is false positive. So let's look at the site A. This will be site A, the intersection will be B, and the other point here will be C. So looking at A, this is going to be 100% sensitivity. So there is 100% sensitivity, and this is going to be the cutoff value. Next is, when you look at C, this is going to be 100% specificity cutoff value. 100% specificity cutoff value. Now let's look at the test results. So here there is a practical compromise between practical compromise. This is going to be between the sensitivity as well as the specificity. So then what we need to know here is the high sensitive test. In case of the highly sensitive test, when negative rules out a disease. So highly sensitive test, when negative, it rules out disease. It rules out disease. So this is nothing but the screening test. Next we move on to the highly specific test. So highly specific test, and this is in case when it is positive. So when it is positive, it rules in a disease. It rules in a disease, and this is going to be a confirmatory test. Confirmatory test, and this is when it is highly specific, when it is positive. So let's look at the various graphs. So in case of the lowering the cutoff of point from B to A, so let's look at this graph. So here, whenever we are drawing graph, we need to know what is X and Y. So the Y-axis, as we discussed, is the number of people, and X is going to be the test results. So on the left side, the peak, there is a true negative, and on the right side is going to be the true positive. So this will be TN, this is going to be TP. Here nothing but the disease is absent, and here there is nothing but the disease is present. And if you see the FN, the false negative, it is slightly moved to the left side. So here it is FN, and on the right we have the FP, that is a false positive. So what is A? Looking at A, it is going to be the 100% sensitivity cutoff value. So here there is a increase in the sensitivity and the NPV, and there is also decrease in the specificity and the PPV. Now let's look at the raising the cutoff point from B to C. So let's look at raising the cutoff point. This is going to be from B to C. So what do we have here? There is the, on the y-axis there is going to be the number of people, and here we are going to look at the test results. So to begin with, we are going to draw two peaks. And here what you are noticing is that there is more of the false negative. So let's write down, this is be the true negative, this is going to be the true positive, this is where the disease is absent, and this is where the disease is present. So to begin with, there is, this includes FN, this includes FN, and here it is nothing but the FP. So this is where the disease was absent, and this is where the disease is present, test results, and here there is C. C is where the 100% specificity cutoff value, this 100% specificity cutoff value, and there will be a decrease in the sensitivity. There is a decrease in the sensitivity, the NPV, and there is going to be an increase in the specificity, the PPV. So what we need to know is the sensitivity. So the sensitivity, that is nothing but the true positive rate. So sensitivity is nothing but the true positive rate. So here the high sensitivity, it indicates a low false negative rate. So a high sensitivity, it indicates nothing but a low false negative rate. Then comes the specificity. So in specificity, it is nothing but the true negative rate. Here there is a high specificity, it indicates a low positive rate. A high specificity, it is nothing but indicating a low false positive rate. Indicates a low false positive rate. So this was all about comparing the low cutoff points in case of the diagnostic test. To learn and grow daily, please do subscribe.